We were not able to find any information on Cushing's disease and the MRS, so I put out a note to one of our local horse clubs asking if anyone had a Cushing's horse that we could try the MRS on. A gentleman responded who has a 36-year-old quarter horse mare, Dolly Bailey, shown here as a much younger mare in her working days. She has now had Cushing's disease for 6 years. She had not been on a special diet nor on any drugs for the disease. Her symptoms included blindness in one eye and little vision in the other, the beginnings of lameness, and long, curly, thick hair, which had refused to shed for many years. Her owner would have to body shave her every summer so that she could handle the California heat. We decided to do a 2-week treatment on Dolly, one in the morning and one in the late afternoon. We used the Enerpulse blanket. Before we began treatment, we had Dolly's veterinarian run the Cushing's blood panels on Dolly to see where her levels were, and to once again confirm the presence of Cushing's disease so that our study could be completely accurate.
Body freezes cortisone on a regular basis. So when you give external cortisone, there's a feedback loop that causes the body to stop freezing cortisone. Unless there's a tumor, then the tumor doesn't listen, and it produces still the same amount of cortisone that it always produces. So, normal horse, you'll see a drop in cortisone levels after the external cortisone is given. But in the Cushing's horse, it'll remain the same.
So in a time period of approximately 4 hours?
4 hours, you already see the effect.
So we'll either, with her, we should have no effect since we already believe she has Cushing's.
Right. So she'll have abnormally high cortisone anyways because of the Cushing's, and then it won't drop.
And this is the cortisone you're giving now?
Dexamethasone.
Dexamethasone.
Okay.
So here we are back again, Doc, about 3 o'clock, 4 or so hours later. And you're pulling blood again. And so now you're going to check this blood for what?
The cortisone level, and just see, if it's remained the same or it's gone down. In a normal horse, it would go down.
All right, so if it stays the same, then
she definitely has Cushing's.
All right.
This is Dr. John Matthews, and he's done the blood work for us, and he'll do the blood work again in 2 weeks. His practice is here in Ramona.
And I've been with Dolly's vet for about 17 years.
Wow, so you know this horse inside and out.
And,
All right, well, Doc, we'll see you in 2 weeks for some more blood work.
okay.
All right, here's Dolly having her very first Enerpulse treatment. After the 2 weeks of treatment, Dolly's veterinarian once again performed Cushing's tests on Dolly. We anxiously awaited the results. Within a few days, Dr. Matthews called to give us the news. We were all so pleasantly surprised. Dolly's pituitary function had improved by 30% in just 2 weeks. We ended Dolly's treatment program, but a month later her owner called, and we were once again surprised but so pleased to hear that Dolly was now shedding her long curly coat. Her owner said it was coming out by the handfuls. Of course, we rushed over to see, and sure enough, Dolly was shedding her coat for the first time in many years, the residual effect of just 28 MRS treatments from over a month previous. We have the study's progression on videotape and DVD, and if anyone would like a copy, it will be available soon on our website, www.zors.com, along with this video and others.